Welcome everyone to today's webinar, providing a straight path from orthopedic payments to practice revenue. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box that you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today to access the recording. We will also have a couple of poll questions during today's webinar, and you can submit the answer that best applies to you directly on your screen in the slides box. You'll see it on the right-hand side, and we appreciate your participation. And lastly, if at any time you don't see your slides moving or you're having trouble with your audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are, of course, here to help. And with that, we have a terrific panel here today. I know a few new additions from our registration page, but with that, I'm pleased to turn the floor over to our moderator today, Scott Becker, who will be kicking things off and letting our panel introduce themselves. Scott, the floor is yours.
Thank you very much, Emma. We've got a great panel today, and we're talking about the subject of providing a clear path for orthopedic payment to practice revenue, or orthopedic practice to payment revenue. We've got a few great speakers from Rectangle Health, a leader in the space. We've also got a couple great leaders from orthopedic practices, Ortho Florida and Florida Bone and Joint, and also a leader from Innovative Healthcare Business Solutions. I'm going to ask each of our panelists to introduce themselves, and then we'll get started. Thank you, folks, for joining us, and thank you to our audience for joining us. Matt, let me ask you to quickly introduce yourself. Then I'll turn it to Alexa, Tony, Dane, Adriana, and Carol. Matt?
Thanks, Scott. Matt McCammon, Executive Vice President here at Rectangle Health.
Thank you. Alexa?
And Alexa Scallan-Dunas, Director of Product for Rectangle Health.
Tony?
Tony McGillen, Partner Development Manager for Rectangle Health.
Fantastic. Adriana?
I am Adriana Weiss. I'm the Chief Operating Officer of IVIS, and IVIS is the practice management company for Ortho Florida.
Fantastic. Thank you very much. And Carol?
Carol Papajohn, I'm the practice manager for Florida Bone and Joint Specialist, which is a member practice of Ortho Florida.
Fantastic. And Ortho Florida, the umbrella organization, Florida Bone and Joint, part of the organization, one of the great single specialty orthopedic practices in the country. Thank you very much for joining us. Dane, let me tee it up with you. You're the Chief Executive Officer for Ortho Florida. Can you tell us a little bit about Ortho Florida?
Sure. Ortho Florida is the umbrella group for the state of Florida. We are a little over 120 providers, spanning all the way from Pensacola to South Miami. We operate as a singular practice under one NPI and tax ID, but we, at a local level, operate very independently, 57 individual care centers, and the idea being that a group can remain small and independent, make a lot of those local decisions that they've always made, but have the security of being part of something larger.
So part of a great consolidated group, but lots of local business units. We're still a great deal of autonomy. So orthopedic practices can figure out how they want to practice locally while being part of a great umbrella organization. Dane, is that a fair statement?
Absolutely. Yeah, we found that the shift in the marketplace right now is going away from employment models with hospitals and large organizations back to the independent practices, but they're finding a lot of difficulty navigating the regulations that are coming down from the federal government. Contract negotiations are very, very difficult right now. In a lot of cases, the panels are closed for those small practices. So by being a part of Ortho Florida, we satisfy a lot of those problems and still allow the practices to operate independently.
Thank you very much. And the story playing out throughout the country is hard and hard to be a small independent practice without some of the support of the larger practice and some of the larger solutions as well. Adriana, Let me ask you a question. What were some of the pain points that your practice centers, the different care centers were seeing, or small practices were seeing, related to payments or patient experience, and what were some of the impacts of those challenges?
Well, it was really the increase of the patient balances. Unfortunately, medical bills are not a high priority for patients, so we needed to put the responsibility back on the patient.
And talk about, a lot of practices did so much of this through their own sort of either homegrown solutions or one-off solutions. Was there a moment where you sort of decided you needed a more significant solution for managing patient revenues and making sure collections were happening how you wanted them to happen and so forth? Were there any sort of aha moments around this, Adriana?
Well, if we wanted the patients to make those payments, we needed to make it as easy as possible for them. So we looked for a solution that could integrate with our practice management system, could also help us speed up the check-in process, and also offer a online portal for the patients to make those payments. So it was kind of like an all-in-one solution, and that's really what we went after. And then last year, when the whole COVID started, we also needed a solution that could offer the patients the ability to make those payments using their own phones, just for their own protection if they want to do when they were at the practices.
Fantastic. Thank you. I know Emma Goodman, who's our manager for this webinar, has our first poll question. Emma, do you want to put that poll question up and answers? Or
Perfect. Well, thank you so much, Scott, and a great start to our discussion today. The first poll question that we'd love for our attendees to submit is, what is your practice's top pain point related to patient payments? Is it collecting unpaid patient balances, reconciling accounts receivable, entering data manually, offering contactless payment methods, sending out paper bills, or maybe something else, maybe other that we haven't mentioned here? We're going to give everyone just a few moments to select the answer that best applies to them, and we'll be able to review the results together here shortly.
Thank you. And Matt will be with you in just about 30, 60 seconds to sort of talk about really what you see from clients across the healthcare industry and about these results and so forth. I'm going to pause for just about 10, 15 seconds. And Matt, even though you don't have the results fully in front of you, you should start seeing what you see in the industry around pain points for getting paid.
Awesome.
Yeah.
Great.
I'm seeing the results.
Yeah,
I'm seeing the results come in right now, and they certainly don't surprise me. And I think they touch on exactly what Adriana mentioned, which is collecting unpaid patient balances seems to be the primary driving force. But then it's the multiple modalities of payment, enabling patients to pay through multiple means. And so, it doesn't surprise me, and that I get to have these conversations literally on a daily basis. And I get really excited about working with partners like Ortho Florida that have implemented this technology and now are able to see the benefits of it creating efficiency in the organization. So no surprises here, but certainly echo that this is what the marketplace is feeling.
Fantastic. And Carol, when you started to look for a payment solution, you run one of the great practices of Ortho Florida. How did you start the search? How did you start to look at this? How did you end up with Rectangle Health? Just give us a little background on how you ended up there.
Absolutely. So our group was evaluating some kiosk-based patient check-in systems. And in the process of evaluating those vendors, we were introduced to Rectangle Health as a payment processor that could both service those kiosk-based systems and replace all of the existing payment processing functionality that we had in place across the practice that was tied to our previous vendor. We started looking at Rectangle Health. We were very impressed with the organization. We also really liked the fact that we could use one processor for the kiosks, one processor for online payments, and one processor for our actual point of sale collections. So it was really a pretty significant no-brainer, and that was before we even learned about the practice management bridge solution, which allowed us to more seamlessly post all those payments into our PM system. That really just sealed the deal for us. Once we learned about that, it was off to the races.
And what was implementation like? How did it get going? Just give us a bit of the experience. I know you've selected Rectangle Health. It's gone well. How is it going?
It's going very well. You know, our structure is somewhat complex in that we had to set up multiple processors, even within the same location. Rectangle was very adaptable with us. They worked diligently to get the merchant ID set up. We had really no significant issues in the process of getting those mids up and running and connected to the right bank accounts. Obviously, worst case scenario is a payment goes to the wrong place, and that has never happened with us at all. Been very helpful with the PCI compliance. So all in all, very, very positive experience with the Rectangle Health team.
Carol, thank you very much. Matt and Alexa, it's a constantly changing environment, constantly changing work with payers, constantly changing work with both how do you engage with patients and with the federal and state programs, Medicare and Medicaid, aside from others. How does Rectangle keep up with the changing needs of providers when it comes to payments and patient engagement?
Yeah, that's a great question. Rectangle Health has actually been serving the healthcare community for 25 years now. And in fact, healthcare is all we've done for 25 years. And now we have tens of thousands of clients that we serve on a daily basis. So those 25 years of experience, coupled with amazing partners such as Ortho Florida, and tens and thousands of them that have just this awesome mind share and these creative ideas, we partner together, and that kind of gives us a competitive advantage to make sure that we're ahead of the industry trends. You know, when COVID hit, Rectangle Health, we were actually ready because we had been focused on contactless and frictionless payment experiences for years leading up to COVID. So COVID didn't change our strategy. It simply highlighted the fact that we have the right strategy. So, you know, we're intently focused every day on serving practices, on collecting the feedback from those partners and from our clients. And we couple those ideas with some awesome technology that takes the friction out of the process.
Alexa, did you want to talk further about, I'm very familiar with Rectangle Health, truly great technology and great people trying to make it better every day. Alexa, did you want to spend a moment on some of the top features of the practice management bridge, the PMB, that Rectangle Health like the most and what they use the most? I know with any software, there's more parts that are used a lot, parts not used so much. Tell us about the features that people love the most.
Yeah, I think Carol and Adriana hit on most of them, the top features, right? We talked about interfacing with the practice management system. That auto posting capability is always top of mind for all of our clients. Being able to stay embedded within the practice's workflow is key. And so by posting payments automatically to the PM system, it takes a lot of friction out of the system and facilitates the reconciliation of those payments. The other feature that is definitely gained traction over the last year, particularly in light of COVID, is all the contactless payment features. So most specifically, we have a messaging component within the practice management bridge solution, and texting is heavily utilized today in order to stay in touch with patients and meet them where they are. So the primary use has been text to pay. So the practice can send a text message to the patient to pay a bill online. And, we're seeing this used primarily after services have been delivered, but also providers are using it at the point of care to collect a copayment. So that's another big feature. And we've got a stat here on the slide showing 53% of patients want emails or text notifications about their payments. They want that convenience. And then the third top feature in staying within the theme of convenience is having flexible payment options. So 2 out of 3 patients want access to payment plans. And we're seeing a lot of our practices offer patients the opportunity to pay larger balances in installments. And so that has definitely become more heavily utilized over the last year as well.
Thank you very much. And certainly a lot of movement towards meeting patients where they are, allowing them to spread out balances, allowing them to work with their practices through text and so forth. It's the way they communicate today, and trying to keep up with that at Rectangle Health. Emma, I think we've got another poll question now. Can you tee that up? And Alexa and Matt, thank you very much for those thoughts.
Absolutely. So we're going to jump into our second poll question for today, and we really appreciate your responses and feedback. The poll is going to be on the right-hand side of your screen in the slides view. Let's go ahead and get to there now. Terrific. So our second poll question is, what functionality does your practice lack today that you foresee adding in the future? Is it text to pay, flexible payment plans, online payments, auto post payments to the patient ledger? None of these things, or maybe something else that your practice is working towards. Again, we'll give you a few moments. The poll is going to be on the right-hand side of your screen in the slides view for you to select your answer, and we'll walk through those results here in just a couple of seconds.
Emma, thank you very much. And I'll get a chance to tee up Tony McGillen in a moment to discuss some of the findings on this.
Terrific. All right, let's go ahead and give you guys a couple more seconds, and we'll shift over to the results here. Terrific. So as we take a look at these results, it looks like, auto post payments to the patient ledger is near 50% of responses, and in a close second, text to pay, with a few other, and online payments also being a popular selection as well. So thank you again for your participation, and Scott, we'll turn it back over to you.
Thank you very much. Tony, Rectangle Health has expertise in a couple different specialties, magnificent. Talk about different types of healthcare practices and how difficult is it for practices to adopt new payment methodologies, and what do you recommend to practices?
Well, in my experience, the most common barrier to adopt new payment methodologies is the assumptive mindset of where to go and what it's going to take. So most think that these tools must be offered through their current practice management system or their current credit card processor. And when they ask their reps if such features are available, and they might be told not yet or no, they assume they're either going to have to wait for the next version or an upgrade, or they assume they're going to have to change their PM system altogether. And right now, with most practitioners experiencing loss of revenue and with patient flow being down due to COVID, along with their in-office team dealing with the changes of PPE and safety protocols, they are mistakenly concluding that adopting new payment methodologies is not available to them. What comes to mind is it would be like me calling a cab company and asking them if they have a Uber Black ride available for me today. And just because they tell me that they don't do that doesn't mean that it isn't still easily available for me to get one. However, I must ask someone else, the Uber app. Consider in that example, Rectangle Health is like Uber. However, what we drive is innovation and patient payments. So I would recommend that practices ask themselves, what if, without switching your current practice management system, you can get text to pay, flexible payment plans, online payments, and the ability to auto post payments into your patient ledger by using Practice Management Bridge? And what if this is all possible by simply reallocating an expense that is already in your budget? By bringing your merchant processing to Rectangle Health, we deliver these tools to you and more. We serve businesses of all sizes, And we put together the technology that is much needed to accelerate the ease of collecting payments.
Fantastic. Thank you, Tony, very much. Adriana, you have a lot of different practices using the PMB, the Practice Management Bridge. Can you talk about some of the efficiencies or things that have worked well with implementing the PMB?
Well, Ortho Florida has over 50 locations throughout the state. So when we decided to make this transition, I needed to make sure that this was going to be an easy transition for all of the care centers. So I decided to split the group into smaller groups of 4 care centers at a time. And then with Tony, we came up with a 3 phone call strategy. So the way that it works is during the first phone call, Tony and her team explain to the care center manager what the process is going to look like, what to expect, and what's going to be needed from them. During the second phone call is basically the IT configuration and setup, and the third phone call is basically training and go live. This really helped us, especially during the first set of care centers, to troubleshoot any issues that were coming up, and then to avoid those issues for the next round of care centers. And it has really made a difference. I mean, I can't say enough of Tony and the Rectangle team. They have been there through all of it, and you know, I think that has made the difference, really. I just can't say enough. It's really been smooth sailing for such a large group.
And let me ask you this question. I'll ask either Adriana or Carol this. Carol runs one of the core sites for Ortho Florida. Any particular benefits that were unexpected in doing this? Whenever you make a change to payment, how you handle payments, how you process payments, any of these kinds of things, there's always some challenges. But were there some, and it seems like the challenges have been minimal, but any expected benefits or unexpected benefits or pleasant surprises? Adriana or Carol, do you want to speak to that?
I can take that. I think by far the biggest efficiency of the practice management bridge is that it takes a manual, very tiresome and honestly, because there's humans involved, error-prone process and automates it in such a way that no matter what your PM system looks like, it can post into, I guess I shouldn't say no matter what it looks like. From our perspective, our PM system was 100% compatible with Rectangle Health. And it allowed those payments to be posted directly to the patient ledger in a very, very seamless way. And of course, you recognize that that's going to free up time for the billing staff to be able to focus on other more revenue generating activities. Probably the perspective that I undervalued or didn't give quite consideration to is how much of a morale boost it was going to be to take a manual process and automate it. Having people that no longer have, that could free up time, but more importantly, free up bandwidth and just the mental load of having to do a manual process was significant for us.
Fantastic. And Adriana, anything you wanted to add to that?
No, I think Carol is right. That's what I've been hearing from all of the care centers is the staff is just so happy that, it eliminated a step for them having to post those payments manually. So it also helps with the check-in process as well.
Thank you. And then Matt and Tony, any concluding advice for participants? What should participants be thinking about or doing to try and stay on top of changes in the healthcare industry and in their practice, business, and world?
Yeah, that's a terrific question and a challenging one at the same time. I think probably my best advice is be curious. And I applaud Carol and the Ortho Florida team. They were curious and they started asking questions. Because I'm a big believer that knowledge is a competitive advantage. And when you're curious, you go and you seek that information out. And you don't have to accept the status quo that you're in. And again, it just all starts with curiosity. And I think that, the knowledge that you gain through that learning experience also positions your practice not just to stay relevant, but to actually get ahead. So we recently did a study with payments, and a couple of statistics really jumped out at me that I wrote down that I thought maybe worth mentioning. One of which was 53% of patients prefer to communicate about their balances via email or text. that's a really informative data point that your patients want to learn about their bill and their amount owed through digital communication, through email or texting. Another one, and this one's almost alarming, and that is 45% in response. This is in response to COVID. 45% of patients would choose to stay home and disengage with their healthcare providers, even if doing so was medically inadvisable. That's alarming. And so, one of the reasons why I'm proud to partner with Ortho Florida and proud to work at Rectangle Health is we're on the leading edge of making sure that statistic shrinks and that more patients are comfortable moving forward with their healthcare experience. And we're creating an environment that enables patients to feel comfortable through that entire patient journey. So anyway, that's a bit of advice maybe that I'd offer to all the folks that are watching and listening.
Yeah, and I would I'm sorry, Scott, go ahead.
No, I was just going to tee you up, Tony. Wanted to see if you had some additional advice to add on to that. Thank you.
Sure. I was just thinking, similarly, I would also highlight flexible payment plans right now. That same study, we found only 44% of patients are getting offered a payment plan in 2020, and there's about 66% of patients that want access to these payment plans. So healthcare providers potentially are missing that key opportunity by not consistently offering a payment plan. The other thing that was interesting I noted was 33% of patients would be enticed to switch their providers to one that has an established payment plan option. So I would say, if you look at the slide, one of the things that we're noticing for those who actually did seek medical treatment is 54% are interested in monitoring their provider payments digitally. It's just the way it is now. And 43% are willing to actually store their preferred payment details at their provider or with their provider. And then last but not least, 43% are also interested in automating those payments so they can avoid the repetitive manual entry, whether that's at the office or online. So overall, the results are showing that patients are willing to find new providers that offer the digital and flexible payment experience that they want.
Thank you very, very much, Tony. Fantastic. We're going to switch now to audience questions. We've got several minutes for audience questions. I've got a handful of questions so far. And let me start with this question. Date of service. Do practices, maybe I'll ask Ortho Florida this, maybe some Ortho Florida could take the lead on this. Do you inform patients before the date of service what they should expect in terms of payments? Is that something that either Dane or Carol or Adriana can answer? Do you inform people before the date of service, and if so, how so, what they can expect in terms of payment?
I'll jump in there. This is Dane. Our practices do this in various ways. I think it's important to know, one size doesn't fit all in this situation. Some practices cater to a clientele that is comfortable receiving their amounts due when they arrive. Some want to see it ahead of time. But what we did find with the Rectangle product was the opportunity to customize that by the practice. So some are notifying them ahead of time on reminder calls, reminder texts, and some are waiting until they arrive. Some, the patients know before they leave what that's going to be. They've already made arrangements for the payments. So there's various ways of doing it, and that's why the Rectangle product worked out well.
And let me ask you a follow-up question, as long as I'm with you, Dane. You're running one of the great orthopedic practices in the country. Obviously, it's a great compliment to Rectangle that you chose them. It is what it is. But deeper than that, how do you recommend that practices think about prioritizing adding new tools? How do you look at what do I have to add first? What's a priority? What's not? What drives that? Where are you going to get the most bang for your buck? How do you decide that?
That's a good question. It's necessity. I think we all just experienced something 8 or 9 months ago. When COVID hit, I know in the state of Florida, we had an elective surgery shutdown. All elective surgeries were canceled. A lot of patients were not comfortable coming into the office. We didn't know how medicine was going to be practiced in the short term and maybe long term going forward. And so we did something that has been in the works or on the horizon for 15 years. We did telemedicine, and we implemented it in the matter of weeks. I think a lot of the practices on the call probably did the same. It was awkward and disjointed. We were doing it in all kinds of different platforms, but we figured it out. And now telemedicine is a huge part of our practice. I am lobbying our congressmen and our state senators to make sure that we keep this as part of our tool package after COVID eases up, for follow-up visits, for follow-up check-ins. It's an incredible tool, and we've been talking about doing that for the last 15 years in medicine. It took an epidemic shutting us down for everybody to put all other projects on the side and just do it. I think the next thing is look at the next project that you've been talking about doing, or that you've gone to seminars at your conferences and learned about for the last 2 years, but really didn't take the next steps to implement because, everyday fires pop up and you have to handle those things. Realize that it is accessible, right? These other projects can be done. And we found the next one, obviously, being revenue cycle management. We have to get the patients paying their bills either at the time of service, before they walk out, or at least a payment program as they leave. Because otherwise, the service is rendered, they're walking out the door, and now we're in the process of chasing. So if you can get that set up ahead of time, go ahead and start that process. I think anybody who hasn't implemented some sort of revenue cycle tool like this, it should be the next thing on your list for priority.
Thank you very much, Dane. And Alexa Skalandunas, pleasure to have you with us today. Take a moment on Alexa. How do you train offices on getting up to speed on these tools? Everybody says it's easy, but in reality it's not easy. But how does it work with Rectangle, and how have you got such rave reviews on this implementation from clients? Because the clients, this is the most concerning thing. They're going to buy a software, they're going to buy a solution. It's going to be hard to implement. People are going to hate it. And you guys have gotten over that hump time and time again in your different specialty areas. How do you do this? How do you go about training offices?
Yeah, we have an amazing implementation team that takes responsibility not only for the install, but the follow-up training. And our approach has been to come at the practices with a number of different scenarios. We spend time getting to know where the areas of biggest friction lie and how they can leverage the system to overcome those pain points. So, if there is a practice whose staff is not accustomed to asking patients for a form of payment at the time of service, getting a card on file, for example, we can work with the practice and how to integrate that into their practice so that it becomes just a standard operating procedure within that practice, right? The patient is presenting for their visit, and you should be having a conversation with the patient about how they plan to pay any balance due, and would you like to keep a card on file with us, as an example, right? I'm using that as an example, but there are a number of other points of friction in the process of collecting payments. So our talented implementation team, again, will work with the practice, the office manager, and try to uncover all of those things, and then work with the practice manager to train the staff on how to use the system in the appropriate way.
Fantastic. Great. And finally, Tony, I've had a chance to work with Rectangle for the last couple of years and watch you guys closely in terms of the mix of technology and great support and great leadership and great people. Talk for a moment, Tony, about the type of support that Rectangle Health offers to their clients.
Well, Adriana was sharing earlier what our experience working together has been on this partnership. And I would say the way they feel about us is the way we feel about them. I would say the biggest thing for any project right now is just to have some compassion. We're all going through these changes together. So I think working together through everything that might be coming our way and working as a partner is the best way to do it. With this team, it's been as much as a project of implementation might be challenging, it's also been a delight. It's been my privilege to be able to work with Adriana and her team. And they know that they've got the ability to reach out to us and that they've got a partner manager development team available to them at any time they might need it. So I would just highly recommend that you come check us out and see if something we have available might be exactly the answer you're looking for.
Fantastic. I want to thank all of you for joining us today, obviously particularly from the practice side, Dane, Adriana, and Carol. Thank you so much for sharing your valuable time and your thoughts on these solutions and how you got to them and so forth. Matt, Alexa, and Tony, Rectangle Health does a magnificent job. We're always impressed by the complete professionalism across the board of Rectangle Health. So thank you for sharing your wisdom and thoughts today on your solution. And of course, Emma Goodman, thank you. It's our audience, most of all. Thank you for joining us today. Love you, of course, to follow up with any of us if you have questions or with Rectangle Health. Thank you very much for joining us today.